So you're dying of cancer. So what? Well, so what are you going to do about it? Are you going to get treatment? Are you going to do nothing? Or are you going to get assisted death? That's available in some states. These are the things I was grappling with recently when I was watching Breaking Bad Season 1 with Walter White. He got diagnosed with terminal lung cancer.
Mr. White. Mr. White?
Yes.
You understood what I've just said to you.
Yes. Lung cancer. Inoperable.
I'm sorry. I just need to make sure you fully understand.
Best case scenario with chemo, I'll live maybe another couple of years.
I've been a clinical ethicist and professor for a couple decades, but I'm also human and I'm retired. So that means that I've got a lot more years behind me than I do have in front of me. So I want to talk about death and dying as it relates to Walter's situation. Now, I don't think I'm going to be dying anytime soon. I almost got killed by a bus twice on two separate occasions. But I think what's probably going to do me in is cancer. Got it in the history of my family and struggled some with myself over the years. So that's probably going to be my ticket. So at least the upside of dying is that I don't have to deal with technology anymore and the frustrations associated with it. So let's start out with Walter White's story. Is that he's a school teacher and he got diagnosed with terminal lung cancer. And starts out that his doctor is saying that, I really need you to understand what the situation is. And well, that was an effort at the initial diagnosis he was looking for his informed consent. Now, the thing is, what informed consent is that you know what your options are, that you're an informed consumer, and because the options are essentially, as the doctor presented, is that you could have chemotherapy, radiation therapy, and a variety of other therapies, or you can do nothing at all, because that's your choice. And that's informed consent. Now, what's really important to recognize is that his subsequent doctor, of course, said that I can't guarantee anything. That's really important because they can't. They can't predict the future. With a certain amount of reasonable certainty, Walter, you've probably got 2 years to live. That is with treatment. It could be less. It could be significantly less. And the treatment may not even work. And it may end up bankrupting you because our health insurance system in the United States sucks. There are positive solutions to that, but that's a topic for another day. So, I'll talk about some of that controversy later on in this video. But nevertheless, he was looking he got diagnosed, and you probably want to consider a second opinion. I know that I would, is that, I want to make sure that those x-rays, those blood tests, that imaging, that someone didn't screw up somewhere. That's called medical error. And that does happen because we're still with humans. So, I don't want to get somebody else's file somehow mixed up. Is that, oh, by the way, you're dying of cancer. Oh, no, actually it's not. It's a skin rash. So it's important to make sure that diagnosis is accurate and that no mistake has been made in that regard. So this idea of informed consent about whether you want treatment or what type of treatment or not treatment, etc., occurs over the course of your treatment. And the realization is that we don't have Medicare for all in the United States. We've got a lousy healthcare system that's actually driven by profit. Can you imagine that, driven by profit? So let's see, what an insurance company is, the less we pay out, the more we make. Do you think that might give them an incentive? Yeah, I do. So anyway, the realization is that a catastrophic illness like cancer could bankrupt you. And in the scene in Breaking Bad, there's this kind of this family intervention, and the son and the daughter, no, not the daughter, is the mother, and the relatives, sister and brother-in-law, are around doing an intervention for Walter because he spilled the beans that, hey, you know, by the way, if I forgot to mention it, other than the dead bodies, is that I have terminal cancer. And so, you know, they start with this idea, these family dynamics that are going on, and one realization, of course, in the background is the possibility that you're going to bankrupt your family, you know, because of your lousy insurance. And is that the legacy that you want to, or is that the legacy I want to leave my family? Oh yeah, what about Steve, you know? I mean, what did he leave us? A lot of debt. So, because the thing is, you could spend all this money and you could still you're probably going to end up dying. So that's a problem. And so it's an understandable situation for the family that, you know, and as well as for the person that has the cancers, you know, I don't want to make my family bankrupt. And particularly if not only we spend all this money, we go into debt and living in a cardboard box, and it still doesn't work because, you know, there's a reasonable certainty in medicine, but not absolute certainty. So on the other hand, there's these other family dynamics that are going on, is that as a spouse, you know, you want your spouse to be with you for a long time. Of course, it depends on how you feel about your spouse, I guess. And so there's a little bit of selfishness as to whether Walter gets treatment or not, is because at least with treatment, the chances are that it would extend his life and Walter would be around long enough to be able to see his daughter at least be born. So there's that part of it. You know, there's this other thing too, is that some people who develop cancer go into remission, and that all of a sudden it disappears. We can't find it anymore. And it's this idea that happens on its own. Now, some people can say, well, I prayed away my cancer, you know, and that I'm not that religious of a person, but how do you know? You know, because cancer, by its nature, sometimes just goes into remission on its own. It's not like it decides, but that's just how it happens. But so this brings up this issue then of a type of care which it's either palliative care or a curative. What's the intention of the care? Is that palliative care is not something that rolls off the tongue. It's actually it's care aimed at comfort only. And that is the possibility is that, for example, let's say that you've decided not to pursue chemotherapy and all the nausea that may likely come with it, hair loss. I've seen patients suffer significantly on chemotherapy. They're not my patients. I don't treat patients, but in the course of my work, and so it's not a pretty sight. I've also had family members, of course, suffer and die that way. So the decision has to be made is about whether at what time do we forego curative treatment and pursue just palliative care, and that is care aimed at comfort. You can have that from the start if you don't want to have treatment or go through treatment or the risk, or for whatever reason you make, you know, you could just pursue palliative care, palliative treatments, and as opposed to curative treatments. That's your decision, and it's a weighty decision, of course. Now, along those same lines is that if someone pursues merely palliative care, is that it's oftentimes associated with a referral to hospice. A person can be referred to hospice within 6 months of death with a terminal illness, or with reasonable expectation that this patient will die within 6 months. Your attending physician certifying that you're terminally ill, you're eligible for hospice, and all of those benefits. Unfortunately, most people are referred to hospice or enter hospice within the last 3 weeks of death. So an earlier hospice referral would be much better. Hospice is a program. It sometimes is in a hospital, but oftentimes outside of the hospital where patients are in their home. And it relates to an acceptance of dying and a spiritual and a variety of other aspects in preparation. It's acceptance of life, acceptance of death, and getting people prepared for that and prepared for the transition that all of us will ultimately go through. Hopefully later than sooner. But this also brings up this idea of quality of life, and Walter brought that up, in the context of, I don't want you to remember me this way as a sickly individual and wearing diapers and just being a burden, and that's understandable. And and of course along these same lines, people don't handle death very good. Politicians exploit it, but what happens is that, they always bring up this idea that, it's the greedy relatives. They don't want you to consume all the resources, so you have nothing left to leave us. The thing is, the reality is that one of two people are going to get the resources if they're all used up. The hospital, the healthcare system is going to get it, or your relatives are going to get it. So this idea that the relatives are greedy and just want the old man to die so they can get the inheritance is, which one is it? Is it the health system that's going to get all the money, or is it the relatives? So all of that is just a distraction because people don't handle death very well. It's not like we've gotten a lot of experience with death, is that we only live once and we only die once. So it's not like we get to practice on dying, so to speak. There's people that got near-death experiences, but it's like a near miss in an airplane, It's either a crash or it isn't, So that's a whole nother topic. But anyway, this idea of quality of life that a lot of people miss out on, I'm afraid, is that so you get to live 6 more months of daily vomiting and diarrhea, or do you recognize the inevitable that maybe it's just time to die? And because none of us are going to get out of this life alive. So the quality of life oftentimes is missed. And it ultimately comes down to me, the person that's actually dying, that it matters to. And that's what Walter was talking about. He says, I should really have a choice here. I mean, choices have been made throughout my life and circumstances, but this is a choice that I want to make. And ultimately he decided, at least at that intervention session, that he wasn't going to get treatment. And that was his decision. And it's important to know all the facts, and as much as we can. We don't ultimately know all the facts, just a reasonable amount of facts. You don't want to make any rash decisions when it's concerning your life, of course. And another thing to consider too is that with the medical profession is that they consider death as a failure. People don't get into medicine to facilitate people's death. They want to enhance their lives. And so the medical profession will oftentimes, as a dint of their training, see death as the boogeyman, as something to be avoided, as opposed to something to be accepted, because otherwise it's a failure. It's interesting how death has changed over the years, or over the centuries actually. We actually used to celebrate death as the Dance of the Dead centuries ago, maybe not in the United States, of course, but the other thing is that prior to World War II, people were dying and living, but they were dying before their time. And the reason being is because we didn't have artificial respirators or organ transplants or a variety of other artificial ventilators to extend people's lives. But then World War II came along, and after World War II, there was the GI Bill. And that created an awful lot of money for universities and grant programs, research grants. And as a result of World War II, interestingly, and the money that was associated with the funding of universities, is that an enormous amount of research occurred, and an enormous amount of positive research resulting in things like antibiotics and artificial respirators, etc., that extended people's lives. And of course, the challenge then became, we are now not only living longer, but we're also dying longer. So that created these ethical quandaries about, when does life end, or when does it begin, etc. And that brought up this issue of assisted death. Now, I studied assisted death in Switzerland years ago. I was a research fellow there, and they have a different take on things, of course, different culture, and but that particular idea of assisted death, which used to be called assisted suicide, sometimes it is, but it's medically assisted dying is what it's called now. But that came into the public discourse because people's lives were being extended, and they felt like their autonomy and their choice was being taken away from them. So they wanted other options. And an option that you always have as an adult is, if you're dying, for example, is to withhold or withdraw a life-sustaining treatment. And and that's your choice because it has to do with bodily autonomy, and to be able to make that choice, no government or religious organization should make that for you. So, but they wanted to go beyond this merely withdrawal and withholding of treatment idea. Withholding of treatment or withholding of antibiotics, withholding of a respirator. That's not mean they're going to just, hey, you don't want the respirator? We're just going to unplug it right here. It doesn't work that way. But nevertheless, this other option of assisted death came up. And I studied in Switzerland and in the United States as well. It's certainly controversial, and the pro-life movement, of course, opposed it. And I'll come back to that in a minute. But it is an option for many people in several states. And they oftentimes find that people do apply for it, but rarely actually, after they've been accepted into the program, so to speak, rarely use it. Because it's kind of an escape hatch for them in case the suffering gets too much. And that's what we want, and that's what I've strived for throughout my career, is to reduce suffering. So assisted death is an option in some states. And that's a positive thing in some ways. And but it reminds me of, there's this great scene from Soylent Green. Now, on the negative side of Soylent Green, they're actually turning people into crackers. That's the negative side. But the more positive side is they have this assisted death clinic, and so they towards the end, and they play classical music and check out the movie, and you drink this potion, which is more along the lines of euthanasia, but it's old, problematic. About how you define it. But nevertheless, it's a form of assisted death, clearly, because ultimately the person is the one that drinks the potion, so to speak. So then he passes away peacefully, and that actually is I think a preferred method for me. If I was in Walter's shoes and I was being treated or not treated, and I was close to end of life, I might consider assisted death myself. Regardless of whether I would choose it for myself, by way of disclosure, I think that people should have the right, competent adults should have the right to make that decision on their own. Now that brings me now to the controversial part, is that the pro-life movement, they're really a pro-birth movement. Because if they were pro-life, in my view, they would advocate for things like Medicare for all. because healthcare is so important. Should be a human right in the United States. It is elsewhere, and from beginning of life to end of life. So this old idea of you're pro-life, well then get involved. Medicare for all. Otherwise, call yourself pro-birth. Don't confuse things. But those folks that are pro-life, they're probably just being used like the rest of us by politicians. Anyway, whole nother story. But, so the one suggestion I would make is that if you don't like assisted death, because you don't want people accelerating their death because they can't afford affordable health care, then do something about the health care. You know, don't just complain about it. You know, there are millions of people. There's about, what, over 250 million people in the United States? And how many knuckleheads in Congress are there? There's around, let's see, 535. 435 in the House of Representatives and 100 in the Senate. That's 535 knuckleheads that are looking out for themselves. I'm starting to getting pissed off here. So, but versus 300 million in the United States, 300 million Americans. Let's see, I think we outnumber the knuckleheads. So there's no reason for us to not have Medicare for all. Or we could say, hey, we want the same health care the United States Congress has. How's about that? You know, okay, I'm going off on a tangent, but nevertheless, the final words, my final words about death for this video is that Walter White faces a significant decision, of course, about whether to pursue treatment or not pursue treatment. Treatment that may bankrupt his family, and they may not work. But bottom line, it's his choice. It's not his family's choice. It's not his religion's choice. It's not some politician's choice. It's his choice. And after being informed of his options, that's informed consent. That's what I think it ultimately comes down to, no matter what he decides. And we have to let that go, because death will come for all of us sooner or later. As I get older, it's going to be sooner as opposed to when I was younger. So it's something I think about a lot, and but it's something that you should always think about. And what are you going to do if you face that same situation? Well, maybe if we all had Medicare for all, or the same health care the United States Congress has, then maybe we could sleep a lot better and one less thing to worry about in life. Hope this helps. See you next time.